What if the way you perceive and interact with the world is fundamentally different from those around you? It's a thought-provoking question, isn't it? This is the reality for millions globally living with personality disorders. These are complex conditions that affect how individuals understand themselves, relate to others, and navigate through their daily lives. Personality disorders are more prevalent than we tend to realize, and their impact on an individual's life can be profound. They can affect relationships, career prospects, and even physical health. Unfortunately, due to lack of awareness and understanding, many people with these disorders go undiagnosed and untreated. It's crucial that we all strive to understand personality disorders, not just for the sake of those affected, but for everyone. Understanding these conditions can foster empathy, promote inclusivity, and ultimately help dismantle the stigma surrounding mental health. Being aware of the signs is the first step in understanding personality disorders. So, let's dive in and learn together. Scene script. Spotting the warning signs of personality disorders can be challenging, yet essential. Let's dive into some of the common indicators. Erratic behavior stands as a prominent sign. It may surface as unpredictability in mood, thoughts, or actions. Someone with a personality disorder might make impulsive decisions that seem out of character, or react excessively to situations that most would perceive as minor. Next, we have emotional instability. This is not your typical mood swing. People with personality disorders may experience intense emotions that can last for several hours to several days. These emotional states can shift rapidly, often without any apparent trigger, making it difficult for them to manage their feelings effectively. Another key sign is difficulty maintaining relationships. This might materialize as a pattern of tumultuous relationships with family, friends, and romantic partners. People with personality disorders often struggle with interpersonal skills, making it hard for them to form and sustain healthy relationships. They may have an intense fear of abandonment or a pattern of sabotaging relationships due to perceived slights or misunderstandings. Lastly, let's talk about distorted self-perception. Individuals with personality disorders may have an unstable or inflated self-image. They might perceive themselves as fundamentally flawed or believe they are superior to others. This skewed self-perception can lead to a host of problems, including low self-esteem, an exaggerated sense of self-importance, or even self-loathing. These signs manifest in everyday life and can significantly impact a person's daily functioning. They might struggle with tasks that seem simple to others, like maintaining a steady job or managing personal finances. It's important to remember that these behaviors are not choices. They are symptoms of a mental health condition that requires understanding and support. Recognizing these signs is not an invitation to diagnose, but rather to understand and empathize. It's vital to approach individuals exhibiting these signs with compassion and patience, and encourage them to seek professional help if they're open to it. Remember, mental health is just as important as physical health, and everyone deserves to lead a life free from the burdens of untreated mental illness. Awareness is the first step towards empathy and understanding. And in the past few minutes, we have taken that essential step by exploring the complex world of personality disorders. We have shed light on their warning signs, from persistent patterns of behavior that deviate from societal expectations to difficulties in interpersonal relationships. However, it's important to remember that our discussion is just the tip of the iceberg. Personality disorders are intricate and multifaceted, and they can only be accurately diagnosed by a professional. For further reading and professional help, consider resources such as the American Psychiatric Association, the National Institute of Mental Health, or your local mental health organizations. Understanding these disorders is not about labeling or stigmatizing. It's about recognizing the struggles others may be facing and showing empathy and support. Let's continue to educate ourselves and others and strive for a society that is kind and understanding. Remember, it's not about labeling, but about understanding. Together, we can foster a more empathetic and supportive society. For more content, like and subscribe.